Well, I'll broadly, when you send me the email and you asked whether I would speak about microfinance, it does seem, it has been almost now 10 years since I have worked on microfinance. And, it's not on account of my shifting interest. Of course, there was a joke in the family that now I do nano finance. But, that was the nature of the research. Of course, there are deep insights. A lot of experimentation happened in the early stage to really understand financial decision making of households. And while a lot of it was, what I would term still under the neoclassical, the problems of people not having information, right decision making. Many times we did believe that there were behavioral impediments, that all the conditions notwithstanding, sometimes households were still making decisions which seemed to be irrational, from the simple point of view. And I remember one of the earlier papers we looked at, but, again, Vishy, from a larger policy perspective, it becomes very relevant today, is, from the health insurance perspective. And I'll focus a little bit on health, largely because that's what now, my life is consumed by work around health. And of course, we are in the middle of a pandemic. But, households, even while they are buying health insurance and they are covered, they are not filing as many claims. And there was a systematic pattern to that as well, which got us into the literature of financial literacy, how much information they had. But even if they had, did they still require certain interventions in the form of nudges, friends coming and telling them to go and file claims and so on and so forth. Subsequently, of course, there were also metrics of what one would call empowerment, because in the normal market sense, when we think we have a good financial instruments and households have already bought it, to not use it would seem extremely weird from the simple neoclassical perspective. So that's where I think the behavioral, my interest in product design, particularly for bottom of the pyramid, if you look at people who are financially fragile, that is where my interest was kindled. But subsequently, behavioral, I think sciences or behavioral economics has now pretty much permeated all aspects of policy making. For instance, even today, despite shortages of vaccine, we know that there is a very significant vaccine hesitancy. Now, for people who are interested in behavioral economics or behavioral sciences, it's important for the researchers, and maybe it is not, it is too academic a discussion in the policy circuit, that is it really behavioral or is it really a lack of information? Is it coming from transparency, a lack of transparency? In terms of efficacy of vaccine, and there's a lot of conspiracy theory. We are also in the midst of age of, I think, misinformation. So before we term everything as behavioral, I think it is important to understand that from a policy perspective, right now, there is a kitchen sink approach. That look, if there is vaccine hesitancy and we are actually wasting 7 to 8% vaccine in certain parts, we have to try everything. A lot of it is information campaign, but now there are very serious discussions on how to work on this hesitancy, how to get people to go and get themselves vaccinated when they are eligible. So, that is broadly, Vishay, as an introductory sort of a remark, I'd say my interest has moved from financial inclusion to health, but in the policy space, I think behavioral sort of an angle, perspective to policy making and appropriate behavior from citizenship or agents, I think is a wider sort of a much more common problem today than it has ever been.
Shamika, by the way, I just quickly wanted to point out, talk about microfinance was more coming from the point of the view that I had read a lot of work there and I cited some of your work. So that's where I just pointed it out. By no means did I mean to, say that that's an exhaustive set of stuff that you work on. Great to know about, I'd also looked at your other work that came out in Lancet recently and a couple of other papers. So therefore, I know the fact that you're going to talk a lot about health, and of course, I'm geared up for that.
Thank you for reaching my level.
Fair enough. Yeah. So let me bring in the other panelist, Jeevant, who is not only a panelist, but also a very valued colleague and a co-teacher and a friend in all, in all those aspects. So Jeevant, if you could quickly introduce yourself by maybe describing some of the work that you're doing currently, and we'll take the discussion from there.
So very nice speaker. Rishi, thanks, Shamika. Good to listen from you. So I work on a variety of topics. So my recent work has been to analyze, what are the effects of gender quotas within organizations. We are seeing these 50% affirmative action for women in various corporations. What's going to be the, impact of this in terms of any blowbacks that we may see? Uh, some recent research has also looked at, how can we sort of increase support for lockdowns. Like it looks like that we may need a second dose of at least lockdowns in regions, in states, and so on. What can we do to increase sort of support for this? Some other research with students at IIMA has been optimal targeting for charities. We also have this whole debate about opinions are very polarized nowadays. So we are looking at any economic effects of such polarization, that there are camps on the right and left and people are not willing to talk. What are there any economic effects of that? In general, this is sort of the more real world relevant research that I have. A lot of my research is quite technical in understanding exactly how human beings think about, say, dynamic problems. How do they approach them? So that's been another side. How do people deal with ambiguity in their lives? How do they sort of process them in their minds? And that becomes a bit more technical. But the good thing is about behavioral economics is it goes back both, as Shamika is saying, to policy making, as well as sort of expanding the horizons for neoclassical microeconomics and saying, these things don't quite work. And here's examples of how people are actually behaving even when incentives are involved. And so what can we do to sort of understand this? But I absolutely agree with you, Shamika, that the first step is to sort of understand standard economics. A lot of the times there are answers there. For example, people not vaccinating because they don't have information. So just to say that everything is behavioral I completely agree that we should not jump the gun. Sometimes the explanation is obvious and it's already explained by standard economics concepts, and therefore I feel that if one sort of knows those concepts well enough, then one actually is better able to sort of say, well, no, there's no such explanation in economics that we all know of, and so therefore we have to go to a behavioral reason. And there is, great research in the past of, for example, Duflo et al.'s research on take-up of immunization or take-up of new agricultural technology because of present bias, for example. So it has been, standard economists sort of working in the neoclassical space have also discovered great applications of behavioral economics in the field. But I completely agree that we shouldn't just jump the gun and say everything is behavioral. In this case, it may simply be a lack of information. I completely agree that we need a kitchen sink approach that's being followed right now. But anyway, my research is there's some work in policy space, as well as in going back to sort of the nitty gritties of economic models. And so I teach behavioral economics here, a course also with Vichy. And and my research is in game theory and behavioral economics.
I have a very interesting question from one of the panelists, but I think we're going to skip this. One of the audience. Which vaccine is more safe, Covaxin or Covishield? I don't think we should be talking about that. We are all doctors, I know, but not the kind of doctors who should be qualified in commenting on that part of it. So therefore, more as an aside than anything else. So let's actually start out some things. Jeevant, I know you've written an article in Scroll recently about managing pandemic with behavioral nudges and behavioral methods. Can you, for the can you elaborate a little bit more on what you've written there? What are some of the policy messages that you have?
Yeah, sure. I mean, so we were working on figuring out, how can we increase support I mean, we did a extensive survey in rural areas in Telangana, where we looked at, very early on in March 2020, April 2020, May 2020, what was the sort of level of awareness? And we were expecting that people may not be aware of various things and they may be hesitant in getting themselves tested or admitted to the hospital and so on. We found quite the reverse. On the contrary, we found that people were extremely scared of COVID and they were willing to go to hospital in a day or two. And they knew all the specifics, that you have to sneeze like that you have to wear a mask, you have to do this and that and the other. We were really, really impressed. And so when time came that, things were sort of calming down, but second waves were sort of starting to begin. We started wondering that, what will happen? Like, how will we generate demands for lockdowns again when we need it? Like, it seems like we need it now in several regions, that we need a lockdown again. So how do you generate demand for it? It certainly, I mean, you can't give information about COVID because people already know all there is to know about COVID. Most people almost completely are well aware of the dangers and the precautions, etc. But we found that simply making the message salient by a simple sort of phone message, 1 minute phone message with no actual informational content, but just making it salient to them, can actually increase support for lockdowns by about 25 to 33%. That people start saying, well, yeah, that sounds like a good policy. We should have that for longer and so on. So really, it makes sense to me that the government still has those phone messages playing on our phones, especially if you call from Delhi or something. You get this sort of 1 minute mandatory message where you just have to listen to a message, telephonic message that's put there. My only concern with that is that it's become sort of run of the mill now, that it is no longer salient in some sense. The messages of Amitabh Bachchan and film stars sort of saying these things, it's been going on since March, April last year, right? And so I think we need to sort of work to make these messages salient. And if we do, our research shows that sort of it can significantly boost demand for lockdown and so on. So I think government also needs to, and all of us sort of need to design sort of interventions where COVID becomes salient again. And so that, is something that, I mean, I see directly from my own research. But I have also started wondering about, this is now conjectures, if all this sort of emphasis on wearing masks in open public spaces backfires when we go to private spaces. So we all know there's a lot of research on how incentives can sometimes backfire. And we have strong incentives for wearing masks in public because the cops catch us and penalize us. But I wonder if people sort of have a limited ability to wear masks for a limited number of hours in the day. And when they go inside, I often see this behavior among our colleagues and friends and so on. The people are so tired of wearing masks through the journey. They come to the AC room with 5 other people and take off their masks. So I mean, this is something I want to research in. I've been planning designs around it, but let's see if I am able to do it or not. But anyway, those two are sort of the main thoughts that are going through my mind right now. Shamika, maybe?
I'm still, getting used to the online etiquette of unmuting oneself when speaking. I don't think I'll get used to that ever. But nonetheless, Shamika, can you add to that, please? I mean, what do you think? How do you think that behavioral research methods, if you will, two aspects to it, actually, I'd like specifically for you to comment on. We are living in the age of misinformation, is very clear. And I think most often than not, misinformation spreads not because people are malicious, right? Misinformation spreads because people are just trigger happy. I got a WhatsApp forward. I felt this is great. Don't bother. Just forward it to all my friends and all that stuff. This is a very peculiar kind of a behavior that I find, especially in health and health-related misinformation that is being spread. So, if you could extend what Jeevant was talking about in terms of using behavioral, economics insights to think about pandemic specifically from health point of view. And I have other questions that I'll follow up after this one. Yeah.
So, thank you, Jeevant. In fact, I'm going to look at the scroll paper. Also because, there are very few surveys, unfortunately. While we have had a year of experimentation, trial and error, but we have few surveys. And this is where I think the NCAER surveys that were done, for me, were very insightful. And, subsequently, these surveys are truly the picture of, what's happening. And since we cannot, we're not seeing large government surveys being done, the NSS, for instance, or even the census was suspended. I don't know what's the update on that. The feedback from the ground of the nature that Jeevant is talking about becomes very, very important to really get a sense of, what's happening beyond, what the news, TV news will tell us, beyond what social influencers, etc., tell us, beyond what politicians tell us. But I think one is, I want to just briefly comment on the demand for lockdown. I have found, just looking at the behaviors across different democracies. For instance, there's a paper we wrote early on the quality of data and whether the nature of the regime, the more democratic a country is, the better the data, the more credible the data coming out of that country. And in that sense, the US, India, they're all flawed democracies, but they have relatively, much better data than authoritarian countries and so on. But these are large macro level sort of informations that we are working on. But, on the lockdown, you're seeing what is happening in Sweden, a country that is openly discussing, debating, and frankly, taking a polar position on should, no lockdowns. You're having that discussion happen in a lot of countries, including in the US, that it really goes against individual freedom. And for those who are wedded to that philosophy, and for them it's a way of life, lockdowns become very difficult to digest, right? But in India, we are not having that discussion. In fact, lockdown, despite the problems faced by the migrant population, as was made aware, through massive reverse migration, what we saw on the TV. But, the Bihar election data, when we started to analyze, we saw that the poor were overwhelmingly voting for NDA. And of course, that had a lot to do with the fact that it wasn't just the lockdown. And therefore, Jeevant, I'm coming to the demand for lockdown. From a policy perspective, these are the big questions that we have to sort of grapple with. People who have suffered probably also realize that, look, these are exogenous shocks. There is, everyone wants to get home. We cannot have the kind of containment with, let's say, China or even smaller but more authoritarian places like Singapore have, that you cannot go back from Bombay, you cannot go back to Patna because you will take the virus with you. So in democracies and our kind of federal system, it becomes very difficult to contain. So lockdown happened, lockdown was very stringent, and yet there is a huge amount of support for it. In the sense, when it comes to voting with their feet, when it comes to election outcomes, when it, a lot of this macro level, when we are studying, we get the sense that people have more or less adhered to what the, in the sense, what the general understanding was that without a lockdown, given our meager health infrastructure, there is no way we can manage this. And people sort of abided. But then we come to the more individual aspect of our behavior, why we don't wear masks, when clearly we know what mask is doing. There is so much literature. And now overwhelmingly supporting that mask might be the single most cost-effective intervention that stops the spread. And yet, you're right. I mean, I tend to do that too. You go out for a run the minute you come home. And even if there are, you just take it off because you're not used to it. And then, of course, you think of the doctors and nurses who have marks on their faces because they've been wearing it for hours. But I think there is a very, huge potential for behavioral interventions. I think we really, good behavior, even when, is it cost of information? Is it compliance, or let's say the cost of, enforcing, let's say, good behavior, like, being fined, the cops catching you. Now, the High Court ruling that you have to wear a mask even when you're driving all alone. So we are having a debate, a policy discussion at one sort of one end of the distribution of behavior, when the risk clearly is perceived to be very low when you're on your own in the car, but we want mask wearing, right? But on the other hand, we are seeing big election rallies. You go to that.
Sorry for interrupting you, but this very interesting point you make. The argument that the court has come up with, that even if you're driving alone, you should wear a mask, is probably as behavioral as it can get, because, scientifically speaking, I don't know, if you're traveling alone in a car, you don't necessarily need a mask, but I think it's a way of getting people to adhere to these rules, and it's a way of telling people how important it is.
Yeah. So I completely agree with you. That is, I think, the better way to look at it, which is that, look, I mean, you want people to wear masks. So the more you begin to exclude, places and times when you need it, compliance becomes that much more complicated in terms to enforce. But I think there is a simpler legal explanation. They have gone by precedence that a car in a public space is public. So in the law, I think many times, as economists, when we are looking for deeper insights, and I think those insights they might be there, but they are really the unintended consequences. The reasons are sometimes more straightforward legal precedents, that a car in a public space is considered public, and that is what the earlier ruling was. So let's go ahead with it. And you're seeing resistance to that as well, by the way. So people are not happy about it and so on, because they are fed up, as Jeevant also mentioned. But, the age of misinformation, Vishy, that you spoke about, and I'm very interested, Jeevant, how you shape your future research on what is happening, what is the economic cost of polarization. It is not an esoteric problem, I think. It is not an academic problem, excuse me. It is a real world problem where we have seen what social media and misinformation can do, the kind of havoc it can wreak to democracies, particularly open plural democracies, which are much more prone to this kind of polarization, right? We are seeing that even in the Indian case. I mean, we are seeing, in fact, even before people open their mouths, exactly what positions they are going to espouse, because we have also, we know that there are buckets and people are comfortable in the echo chambers that they that they have joined. But policy making clearly, and even if they're peripheral, mind you, this is I think the interesting thing about democracies, that even though popularly elected governments clearly have the mandate, so they're going about it the right way. But governance, meaning day-to-day governance, is not about knowing what the truth is, because human behavior is so complicated. And I think that is where the role of expertise and data comes in, that we don't know what is the best way. So when someone asks you whether Covaxin is better or Covishield is better, we will probably start to look at the data, but the policy response is, boss, whatever you are getting, if you are eligible, get it. Because there is no choice in the market. And this is not just, there are very few countries that actually have choice. So I think the framing of the problem becomes very important to, first of all, even analyze it, I think, from a research perspective, if we're really interested in deeper insights. But it becomes equally, maybe if not more important, from a policy perspective, that sometimes we tend to ascribe to a hypothesis, a certain phenomenon, while the reasons might be totally different. And they might be much more mundane and not as sexy as, our research would like it to believe. And that is where I think the conversation amongst economists, I think the polarization does a lot more harm, I think, to the field. And I think also we should talk more to the political scientists, because clearly now, when we talk of large policy making, we're talking about human rights, individual rights. This is really at the sort of the cusp of economic behavior. This is going back to Lionel Robbins' definition of economics, study of individual behavior, human behavior, but also in the governance structure of democracy. Policy has to incorporate both, that where are we overstepping, and what are the real levers which will be most cost effective.
Thanks. I would like to extend the discussion on this. You talked about a very interesting argument of polarization, and I think I see a very relevant and excellent question that came out from the audience. In that sense, Dhananjay, I think, is the one who is asking this question, and I think This is how I understand it. There's a COVID message that's going on. There are COVID sort of restrictions, rules. Jeevant says demand for lockdown, as scary as it is, it might probably be the only solution, etc., etc. Is the message perception different from different groups? I mean, Shamika, you've been doing a lot of work on policy and data related to COVID. I know your Twitter handle is very, very popular, and people follow that, including myself, for the data and all that stuff that's coming out. Is there a different perception among different groups about COVID? Do you see something like this, or and if it is, can we actually have a discussion around it in terms of what's making COVID message take? What groups are more? Is it generated by political polarization? Is it generated by economic polarization? How do we define the word polarization actually in every sense of the word? Because to me, that's a quintessential behavioral question. When you ask somebody, they would define polarization from the point of view of financial aspects. Some of us who probably have no problems worrying about that aspect of life will probably be talking about thought process and all that. My grandmother will be talking about completely different aspect of religion and a few things like that. So if I could ask both of you, since you've been doing a lot of work on this area, how do you define the word polarization in one sense? And, how is it that you could make the messages that are of public importance, especially something that comes out during pandemics, or during national emergencies, if you will, right? To be universal and overcome this issue of polarization. Sorry, I'm going to stop here. People are here to listen to you. So go ahead, please.
Jeevant, you want to go first?
Well, so sure, I can go first. But so Vishi, in my research, we looked at a very synthetic sort of, so we wanted to study the effect of polarization very carefully. So actually idea of some of our MBA students in my elective course, that they manipulated, sort of created synthetic Twitter profiles and added a couple of controversial aspects of, say, about abortion or some of the controversial policies that governments have. And they looked at, suppose Shamika has a complete extremely different opinion from me on a sensitive issue. And if I see her Twitter profile, and then Shamika and I enter into an economic negotiation, how does that negotiation go relative to the case where Shamika and I are on the same page? And we found, the students and I sort of together found that economic negotiations sort of collapse when you don't like the Twitter profile or the opinions sort of put forth by somebody you're negotiating with. So what we sort of found in our research was that if you find that the other person is from the other end of the spectrum, the economic negotiations between you don't run so well. You don't trust them. You are sort of you give up on deals that are mutually sort of beneficial to you. And, think about it. A lot of our economy works on trust, on small business people owning their own business, mom and pop stores, negotiating. Everything works on trust. Not everything is written. Very little is written in terms of legal sort of documents or it's, contracts, etc. Right? So a lot of it runs on trust. And when that breaks down between these sort of polarized opinions, then we have sort of lots of money left on the table as a society, because we didn't go into a negotiation that would have been mutually beneficial. We didn't do a trade that would have been mutually beneficial. And so we have to sort of be careful in sort of generalizing this to the entire economy, but it's a worrying sign that, different opinion on certain political matters can sort of affect our, economic activities. And so this is, a point made by many thinkers that, polarization is hurting and so on and so forth. But we sort of said that, no, let's look at it carefully. Let's try to study it carefully. And it certainly lab evidences that this is the case, that people are losing out on good deals because they have polarized opinion. And so, there are real economic costs of actually having polarized opinions. Now, on the aspect of COVID and polarization, I hope that, at least what we found is that there was, on the ground, we found that there was not, people were sort of trusting government sources, central. So in Telangana, BJP is not the government in power, right? The NDA is not the government in power. Yet they were trusting NDA messages as well as sort of Telangana messages and so on. So it wasn't that, there was a distrust of central government because there's a different party. So so that's what we found in our limited research. But that's all I have to say about that. So maybe Shamika can sort of step in right now.
Thank you. So Jeevant, I think it'll be fascinating to measure the loss due to polarization. But of course, we are defining also economic cost very narrowly right now, because naturally, you want to be able to measure it. But, we know the social capital, the kind of cost it is going to inflict in society, because there is a lot of trade, which becomes very difficult to even measure, right? But clearly the explicit ones, when there is a transaction, flow of money, let's say, and therefore the money on the table, it becomes more explicit to measure. I think that will be a fascinating piece of research, and I definitely look out for it. I think we'll have to extend, because it is becoming a part of our day-to-day lives. And of course, like in the US election, we did see what role misinformation can play and sort of lack of trust, etc. But I believe, the best way to fight this is through information and more credible information machine. And I think this is where it goes back to the problem at hand, which is more immediate in terms of the polarization happening from COVID itself. We are fortunate that we are not seeing the kind of protests which the US has seen against masks, for instance.
Absolutely.
We are not seeing the kind of rioting which Ireland, economies after economies, countries are fed up. And so now you are seeing that come out in various forms. Now, India is a very large country, but from whatever is being measured and talked about, and of course, despite the claims, I think media here is relatively free and loud, thank God. So we are getting a sense also from highly local, areas. Sometimes it could be because of elections as well. The local reporting seems to suggest by and large people are complying. And I think that is what, the survey that Jeevant talked about, that sort of reinforces that belief despite hardships. And I think this is where, like, the hardship is what your economic cost is, to some of these policy interventions. People are by and large compliant. And, but of course the issue is for how long. And that is where I think lockdown as a decision has to it has to be debated now. Because the reality is, and this was an early paper that came out, from the Brookings papers that, in last fall, when the first quarter reduction in the GDP happened, almost 24%, there was a great deal of worry that why is it that while in Europe we understand they've had massive number of deaths, so the COVID death rate itself is very high, for those countries to go into complete lockdown and therefore to see a reduction in GDP, economic activity, is understandable, because that is the cost you are paying for the spread of the virus. But in India, where the death rate has been low, even if you account for the fact that there are reporting problems, but even in places like Delhi, where there is a lot more scrutiny, the courts are involved, the media is involved, the death rate is not anywhere close to what Western Europe or the US, etc. are having. But even here, the economic lockdown, if you look at the decline in economic activity, huge, right? 85% decline over March, April, etc. April, May. So now the discussion of one is generating demand or broadly selling the idea of going into a lockdown, but the other, which is a much more policy relevant question, is for a country of our level of income. We are not affluent by any metrics. And while technically we might fall into the lower middle income or whatever, we are still a very poor country by many metrics. So for us to go into a lockdown, the opportunity cost is very high. And in terms of livelihoods, the COVID is not the only cause of death in India. And I've been saying this since March, that I understand why we should go into a lockdown in the beginning when we did not understand this beast. This was a totally new, and we knew the reality of our healthcare infrastructure. We didn't even have proper masks, PPEs. Many states, forget districts, many states did not have ICMR approved laboratories. So we could not even have tested. From that reality to, let's say, 6 months later, by September, October, when every state has that basic infrastructure at the district level, that basic infrastructure which supports need, I mean, which is required for a pandemic like this, it has been put in place, right? Now, going into a lockdown now against a death rate which is like 120 per million, while Europe has 2,000 plus in many parts, that is the serious discussion we have to have. We cannot be mimicking other countries in terms of lockdowns where our death rates are not. Infections are high. Now, but this is where Vishy, the science is also polarized. Let's not pretend that the science is very definitive. Like, as economists, we are looking at the numbers and that is the best we can do. The epidemiologists have stuck their neck out and been burnt repeatedly. But the virologists and the immunologists are yet to tell us why is the death rate low in India.
Yeah.
Right? Is it innate immunity here? Is it the virus itself? That the sort of the strand which is, you know, common here might not be that you know, deadly, etc. That information is just not available. Now, against that lack of information, this trial and error, the policy making therefore becomes one of, you know, making huge policies in the middle of a lot of uncertainty. We really do not have information on a lot of it. And therefore the lockdown decision, I think, is a you know, compliance. Yes, I think we should improve people's behavior. Cancel parties if you don't have to. Why are we having weddings of 500 people? Right. You know, Delhi has been partying now for many months. And then, of course, then you get calls saying, number kyun badh rahe? Why do you think it is increasing? And then, you know, so we have to introspect as citizens and individuals. And I think that is where the behavioral interventions are very, very useful.
Absolutely. Yeah. No, I think interesting points you make, but I'm going to push a little bit. I mean, I think, sorry, but when I was initially thinking of moderating this panel, and given the profile of both of you, I was thinking of talking about multiplicity of topics, but suddenly now I realize that 50 minutes is too short to just even move out of COVID, actually, to be honest. And so therefore, let me stick to it and do a good justice to this one topic of health and COVID and not necessarily labor on others. At least in the interest of time, let me open this up. One of the things that I've noticed COVID has done is health insurance and the importance of health insurance to the citizens. We also know from the data that the adaptability of insurance in India is slightly on the lower side, even among the community that actually is able to afford. What can we do in terms of behavioral nudges that would make healthcare available to all? You know, that's one side of it, which is a policy. I'm not going to get there, but more importantly, what can the citizens do to make sure that they are able to afford the healthcare in the form of insurance, if you will? What can we do to help to make insurance more acceptable to the common public? Maybe that's a long and short of the question. Shamika, if you could.
That's such a fundamental question, Vishy. And I think in the policy circuit, it gets pushed aside or brushed aside as, oh, it's an academic discussion and so on and so forth. But I think it is right now where we are sitting, where India's healthcare policy making is concerned from a long term, let's say 100-year perspective. We are sitting at a very important juncture where we have to determine whether our long-term health care is going to be financed by health insurance as a financial instrument, or should we really be doing more?
Yeah.
Because we know what private market-driven health insurance can do. We are seeing from places like the US. US spends 18% of GDP on healthcare. And they have more or less similar, if not worse, health outcomes as Singapore, which spends 4%. So it's not about how much you spend. It's about the nature of the instrument. You know, what is the incentive structure which is a commensurate or imbibed by a certain financial instrument. Insurance, as you know, at least three of us are very well aware, insurance has deep problems of information asymmetry.
Absolutely.
Moral hazard, and the kind of overutilization, adverse selection, who's getting insured or who is seeking, the people who think, who need it. And therefore, the market becomes one where you need compulsory coverage, etc., right? Which is what Ayushman Bharat is attempting for the bottom 40%. And they've done a great job of extending RSBY and really extending the coverage itself. So the value for money in that sense, it's good, and it's a great step towards universal health coverage. But we have to worry when a lot of it, the reality is a financial instrument. Health insurance is just that. It is as good or bad as the actual healthcare it can buy, right? So imagine in states where very large percentage of your healthcare is private. It is not governed by the same set of incentives that public health structure is, right? So we know, for instance, if you look at the data, and we have a sort of a series of papers looking at across states, who uses district hospitals, right? Government infrastructure. And we are seeing that, in states where government hospitals work well, rich and poor, across quintile groups, people are going to district hospitals. It's like in Delhi, you go to AIMS because you know that there is no overutilization in terms of overdiagnosis. There is no incentive that the doctor has if you have access. Of course, it's one hospital, and therein lies the iniquities. But in places where you don't have well-run health infrastructure, public infrastructure, it is not like the poor are necessarily going to district hospital, though it is bad, and the rich are going to the corporate hospitals. That's not true, because healthcare is so immediate, and it is, it's like all your fundamental rights as a citizen are suspended the day you fall sick. So it is so basic that even in places where even poor people are prefer to go to private care and pay a lot of money than go to a bad government hospital. And therein lies the big problems of health insurance from a long-term perspective for India. That in states where costs are not going to escalate, because that health insurance is basically financing care which is in the public sector.
Right.
Right? Because cost escalation is not going to happen. And why do I say that? If you look at government hospitals, 12% of deliveries are cesareans.
Right.
And that is about the general sort of incidence in nature. 10 to 12% deliveries tend to become complicated as a natural phenomenon, and therefore require C-section. In the private hospital, that number in many states is 36%. Now that is, that's a multiple. And it's telling you what incentive structure in private healthcare can do, even when you have publicly financed health insurance schemes.
Correct.
So from a long-term perspective, I think the sustainability or the viability of health insurance becomes a very big
question. Yeah, it has to be questioned.
Health structure is not,
I mean, one of the behavioral things that I am noticing, and I think this is something that comes out of my work with Sanket and one more of our PhD students, is this that we got to stop calling it as healthcare expenditure at some point, and we'll have to start calling it as healthcare investment, because the more money countries are putting in on healthcare, the greater would be the effect on not just GDP, but also in terms of innovation potential and entrepreneurship and all that stuff. These are some of the effects that we are finding. So therefore, I think it's an excellent point you make, saying that at some point in time, we'll have to think of moving to a more sustainable system, which is partly government controlled, partly private controlled, but you do have to move away from the insurance base, because the amount of information that you're talking about that needs to make private insurance work is in some sense compromising on privacy of every one of us in a significant way.
More than the privacy, I worry about negligence, medical negligence. Private care is not well regulated right now, so there are all those other tensions. But Vishy, too, the sort of the other part of this question, when you say how can you get people to take insurance?
Yeah.
And while we have insurance finance and we can work on regulating private care and improving public health infrastructure, we have a very early paper in World Development, which looked at microfinance clients. They were paying for the health insurance through their loan because it was a tied product, as is typical in microfinance. But the women were not filing claims, right? So we went and we said, these aren't necessarily the healthiest people. Their claims to coverage ratio was 1/10 of what you see in the mainstream market. Now, clearly it wasn't health outcome. They didn't know about it, right? And who didn't know about it? That they were usually women who were wives of the borrowers. So with women who are covered. So there is also a strong gender angle to it, right? I mean, as you know, this AIMS paper, we have 40% female patients are missing from AIMS. health insurance or no insurance, the family is not taking them to hospital. AIDS is practically free. That is also similar to analyzing the health insurance. You are covered, but you're not filing claim. Highly irrational from the neoclassical perspective. We are thinking, what is this? And I think that is where, more surveys trying to understand decision-making on healthcare, who is making decision on when to seek care, matters, right? And for young women, we know that young women and older women, if you look at girls under 20 and women over 60, their access to hospital is pathetic. I mean, because somebody else is making the decision and so on. But, on a sort of a last note, I'll also say insurance is a very difficult instrument to understand, Michelle. People understand savings. Savings is something very innate. We all do it. Even if you take loan or not, everybody saves. Insurance is very, very complex. So, how it is sold in the market. Remember the case of rainfall insurance. It was the coolest product on the shelf of, international policy makers developed out of World Bank, etc. 25 years back. Look at the take-up. It was supposed to be this very cool derivative which got over basis risk and, really something we should have seen huge uptake. Nobody's buying health insurance. Rainfall insurance. Nobody's buying weather insurance. Why? Too complicated. So I think that is where financial literacy also gets tied in very deeply beyond just behavioral sort of nature of the problem.
Jeevant, any further thoughts on this?
So there have actually been very nice sort of studies pointing out certain behavioral reasons. For example, something related to what Shamika is saying, that because there is this learning curve in these financial products, because there is this sort of learning curve in new technology, it's been shown that present bias sort of prevents people from taking up these products. That, I'll have to learn all about it. And so how will I figure this out? And so let me just sit on my status quo and not sort of try to delve into these fancy new things and not take them up. And so there, some interventions, for example, to improve take up of new technology in agriculture has been to sort of this fake sort of effect where, you say this sort of offer is for limited time only. And to make present bias work in the other direction, that this offer is sort of available for sort of financial inclusion or new technology just now, and it's going to go away soon. So this is some research done by JPAC. So I think, the way you pitch it, as Shamika is saying, by studying interventions that during using RCTs, sort of have some sort of innovative designs to sort of use behavioral principles to sort of increase take up of these things, because you have to recognize that this is complicated. Somebody will need to sort of sit down and spend a lot of time sort of thinking about this. Another reason financial instruments have not taken up, for example, stuff like rainfall insurance or crop insurance, is because they often provide partial insurance, and so ambiguity doesn't quite go away. So even though the risk component of uncertainty goes away to some degree, ambiguity stays there for a large part. And given the complication, and you add all of those things, and it reduces sort of take up. So this has been some study done in Malawi and some other African countries where ambiguity aversion was also sort of a big role to play. And so I think this is also where people say, why are RCTs important? Well, you're thinking of, let's say, 2 or 3 or 4 possible interventions. How do you find out which one is the best one? You gotta go and test it in the field. There's no other way but to test this. So that's how, for example, the take up of agricultural technology was improved. That you say that well, this sort of technology is available only in the harvest season for the next only so many days. And then we won't be, supporting you. And then that creates the sort of recency effect, and present bias is turned on its head, and you say, no, let me go and sign up for this and learn this. How do you find that works? You have to sort of test this using RCT, because otherwise we can sort of keep going in circles and saying, well, this may work, that may work. That's where experimentation comes into play. That you got to go and check it out. And I think more and more, so there are some question on this as well, right? do are behavioral principles used in Indian government, state governments? So absolutely yes.
Yeah, absolutely.
Working overtime. There's a Bill and Melinda Gates Foundation backed sort of Center for Behavioral Sciences and so on, doing these studies. And so, please feel free to go and look up this stuff on the central government and state government. So I find more and more state and central governments amenable and sort of excited about sort of testing possible interventions and then only sort of implementing them. So I'm a bit optimistic about these things, that I think I see the sort of the trend headed in the right direction, that policymakers want to test possible interventions, see if they work, and then scale them up. I find, this is a sort of, we're headed in the right direction in this sector.
Right. Jeevan, thanks for pointing it out. I'm sure you understand that most of the requests we've been getting in terms of when corporate training and all that stuff has been on behavioral economics. There's been a significant uptake on it in the recent past. We've been doing a lot of classes together.
Yes.
Shamika has been doing a phenomenal work by being in the forefront of policy. So therefore, I'm a part of one of those GST councils, sub-councils that talks about behavioral. So therefore, I think to just extend the point that you're making, do state governments and Indian governments listen to behavioral methods, behavioral sciences? Oh, I think absolutely yes. Shamika, maybe I'll give you the final word in extending that particular topic, at least in the interest of time. Can you just talk about some of the cool stuff that's happening in the behavioral side from the policy front?
I completely agree with both of you that the window of opportunity of making a difference in terms of suggesting policy recommendations which are in the behavioral realm, it has never been more open. So I think there is a great demand for suggestions, recommendations, advice on behavioral interventions. So and I have personally sort of been dealing with several chief minister offices. These are states level. The CBS has an office which has sort of a nudge unit similar to what the UK, the PM initiated several sort of many decades back. But we also have that kind of interest in the central government. NITI has several discussions going on it. I think it is not the demand which is a concern. I think that right now, or maybe it is just the, as researchers, we have to again introspect internally and see, have we defined the problem well? Are we suggesting behavioral interventions for problems which are fundamentally bad information, high cost, so that is number one. Number two, I think, and Jeevant, the way he framed it is absolutely right. Which is the best intervention? When there are so many alternatives. And I think this is where we are pretty shy of spending energy on trying to actually understand. And I think that is the core of development economics, of what are those interventions. See, because mechanically we are very good with the RCT. And I think that is the reason I have some degree of sort of what disillusionment, Jeevan. I'm a bit older than you, so I have that sort of luxury that I did start out my research career doing RCTs, and then it's like the financial literacy machine. But I think the learning from a lot of my own mistakes, I would think, is that while we were so heavily focused on designing of the randomized control trial and getting the mechanics of it right, when in hindsight, it's a mechanical exercise. There is nothing deeply intellectual or insightful, I think, there. That we don't look at the interventions enough. That why didn't rainfall insurance? So we did several experiments on financial literacy. A lot of those interventions were like 2-minute, somebody going and explaining different kinds of interest rate. That is just bad intervention. Of course, we did the RCT for that. Similarly, I think we have to sometimes go back to core of development to understand why are people behaving the way they are? Why are they not taking up these things? And that is where I think we need to work a lot with local level NGOs rather than tell them how to do things. Frankly, a lot of the insights I have gained are from the villages, from the NGOs, because those guys know, okay, madam, ye sab theek hai, but koi nahi lega. And then you can't tell them, but if we do this, then I'll test and tell you whether it works or not. You see, that has typically been our way of going about it. But so I think while the policymakers are very open to a lot of suggestions, we have to do a lot more work. And I think I'm glad, therefore, that you guys are, not only teaching this as a course, and therefore there'll be sort of future, a pipeline of scholars and researchers looking at these things. But also, I think working across disciplines and working on the grassroots with grassroots level institutions, etc. Also, grassroots level government. Sometimes the BDO and the Gram Panchayat, office will have much more insight than talking to ministries in Delhi. So I think behavioral interventions require us to be, to dig a little more than what we have in the past when we have received large data sets, ASI data, NFHS, NSS. We have worked on that and we get very good insight. But behavioral requires us to, put in a lot more effort working with people.
So I got on to one point that you actually said, talking to the ground level people would help a lot. I actually would believe that my discussion with some of the ASHA workers in one of the districts in Gujarat has taught me more about health and ground realities of health than my all research put together. There's no question that 1 hour conversation I had with 5 ladies out there ended up with a translator, ended up teaching me a lot more than what I would ever have learned. And I think that's the key that I actually notice in terms of making behavioral methods and interventions a bit more amenable to policy making, which is that economists will have to start getting closer to the ground reality, start talking to the fundamental people out there who make the grassroots stick, and then from there come up with interventions that could be taken up at the policy level. As much as I would love to continue this conversation, I'll have to, in the interest of time, we're already 7 minutes over the time. In the interest of time, I will have to stop it here. Let me not abuse my power of being the moderator beyond this point. So on that note, I'd like to thank both Jeevant and Shamika for excellent point that they've raised for today's discussion. And yeah, thanks very much, guys. Looking forward to meeting you in physical form sometime soon. Hopefully, that's a hope that I'm leaving almost every meeting with nowadays. Thank you very much.
Thank you. Thank you. Thank you, Jeeva.
So we will now continue with the paper presentations. We have 2 excellent papers. One is going to be presented by Ronak, I guess, and the second one is going to be presented by Suresh. Ronak is going to talk about tax evasion and altruism. And this is a paper that's joined with Dr. Thiagu Ranganathan, Center for Development Studies, Trivandrum. Ronak, you'd like to take over and start your presentation?
Yeah, thank you. Thank you very much, sir.
So you roughly have, I know we are running a little behind the schedule. So you will have 25 minutes. So 10:25 is your time. Yeah.
Okay. Can you please confirm if you can see the screen once, sir?
I can see the screen very clearly.
Okay.
Thank you very much. Yeah.
Okay. Okay. Thank you. Good morning to everyone. It was a very nice panel discussion on a very pertinent topic. Myself, Ronak Sel, this paper that we're going to present today is entitled Tax Evasion and Altruism. And I wrote this paper along with 2 of my professors, Dr. Thiagu Ranganathan, Associate Professor of Center for Development Studies, and Assistant Professor Dr. Ajit Vishwas, CDS, Trivandrum. Now, before we delve in deeper into the context of the paper and how we designed it, let's look at the contents. So first, we're going to introduce the topic to all of you and talk about how we have thought of this particular paper. And then we'll talk about the setup of the model. So it's basically a theoretical research, a theoretical model that we proposed, and we came up with 3 propositions based on that. So we're going to talk about the setup of the model, and then we're going to talk about the propositions that we got. And that's actually the first part of the model. And in the second part, it will be an extension. It will get extended to moral costs and the evasion avoidance, tax evasion, tax avoidance trade-off that is existing, and how to deal with that, how to rather address that issue, and then finally we'll conclude. So with that, let us start. Now, the problem of tax evasion, not only for the for the government of India, I'd never say that, for the question of why people evade taxes is something which is ubiquitous, something that has hampered the growth of many countries and has been a matter of grave concern for governments across the world. Now, to talk about the theoretical contributions in this field, the first two names that come to my mind, at least, is the Allingham-Sadmo model and the Srinivasan model of 1972 and 73. And post that, of course, Eatsky in the year 1974 also added to that, which later on came to be known as the ASY model or Allingham-Sadmo-Eatsky model. They basically talked about or focused on analyzing the impact of economic, or so to say, the pecuniary factors of the tax compliance decision of the taxpayers. In other words, they focused more on the penalty rate, the tax rate that is being imposed, the attitude towards the subjective knowledge of tax system existing in the country, or which is there amongst the taxpayers. So such pecuniary factors were forming the core of their research and their papers. Now, if everything was going fine, of course, except the urge of the researchers to find out new pathways to trade on, what else happened for which they had to reconsider their research and try to move on from analyzing pecuniary factors to non-pecuniary factors like emotional responses, altruism, trust, fairness, and other things. Two things. One is the emergence of behavioral economics. And secondly, there was a mismatch between the theoretical predictions of these traditional models and their empirical results. So it was found by Porteba, Nosrad in the year 1989, 1992. They found that the predictions given by Allingham-Sadmo model or Eatsky model, they found that they are not matching with what they got in their respective field research. So they saw that, in spite of having a very low audit probability, in spite of having a very low probability of getting caught and low penalty rate, even then the compliance behavior was quite nice. I mean, it was going against the theoretical predictions of Allingham-Sadmo, because they said that if you have a very high penalty rate, only then the compliance behavior will be nice and the way you expect, otherwise it won't be. So that was going completely against it. And after that, Alm Togler and many other researchers started talking about the importance of psychic cost, the importance of the fact that people do not always behave like a machine. They are not rational taxpayers. They also have the behavioral characteristics that need to be taken into consideration. And that's where the discussion of moral emotions into the literature crept in. And it was first found in the papers of Bergstrom, Bloom, Varian in the context of public good, war, and the results of which were little challenged by Andreoni in 1990, the famous paper of warm glow giving. And that's how it continued. And after that, hyperbole discounting or prospect theory by Yaniv 1999, or Gordon 1989, where he introduced reputational cost, and then it went on and on. So what we are trying to do today, or what we have tried to do in this particular paper, is that we have taken the base model as the Allingham-Sadmo model, the seminal work, and tried to extend it by introducing few of the characteristics which we believe were previously not present in the previous studies. So we basically find, in a nutshell, if I have to say, we basically find that, altruism or altruistic preference may conditionally reduce the need for a high penalty, and sometimes the external punishment cannot unambiguously reduce evasion, as was predicted by Allingham-Sadmo or Srinivasan or the previous studies. And then we extend it further to address the evasion awareness trade-off. Now, of course, due to the want of time, or to be able to respect the time that is allotted to me, I may not be able to get into the mathematics of what we did, but I'll surely be able to touch upon the intuition part and what we thought should be intuitively justified. So with that, let's start. So the basic setup of the model, as I said, is building on the Allingham-Sadmo model of 1972, but departs from it by assuming the altruistic preferences. So the two key features in our model, at least in the first part of the model, is as follows. We have introduced a unique parameter, alpha, that captures the altruistic preference. And we have said the only restriction that we imposed is that the alpha has to be greater than 0. So we haven't said that alpha belongs to a open interval 0, 1 and 1 is the maximum limit. We wanted to even go beyond 1 and see what happens. And then what we introduced also, we introduced a variable, exogenous variable called M. What it means is we wanted to segregate the benefits derived from a government's welfare expenditure funded by the tax payments of the taxpayers, of course. Part of that is being accrued to the agent, the rational or the taxpayer in our model. And the part of that payment or that benefit is being accrued to the rest of the society. And that's how we're dividing into two parts. One is the utility function that is capturing the selfish self, and other one that is capturing the self which is concerned about the society at large. Now, how we're building it? So let us assume that there are n identical taxpayers, each of whom contributes equal amount of tax payment, let's say xi. And we then aggregate the population to unity. So, so then n becomes 1. And then we come to this problem of expected utility maximization, where the decision maker maximizes the following expected utility, as you can see. So what are the terms that we're using here? We are using these following terms, which means that, W is the wealth, summation xi is the total sum of the declared incomes, P is the probability of getting caught. Then we have theta, which is the existing tax rate. Then we have the pi, which is the penalty rate. Alpha, as we said, the proportion, the parameter capturing altruism. And last but not the least is the M, which is basically the proportion of the welfare expenditure received by the individual respectively. And that's how we design it. So we just play a small trick here. We, as I said, we aggregate the population to unity. And then what happens is this summation xi, as you can see over here, the summation xi becomes nxi, and because n is 1, so it basically becomes xi when you consider that to be x. And then we come up with this little simplified way of looking at this particular equation, just to avoid clustering of unnecessary terms. And as I said, the utility function U refers to the utility from the amount left after paying tax, and V refers to the utility from the proportion of the tax payment that goes to the others. Now, with that, we try to now find an interior solution. Now, for an interior solution to exist, we know that the marginal rate of change of the expected utility. So we differentiate E of U with respect to X, that's the decision variable. And we evaluate that at X equals to 0 and X equals to W. Of course, we have already found out the first order condition and the second order condition, which is satisfied because of the assumption of concavity that is invoked. So those things are already taken care of. I'm not giving them because it will be way too many equations otherwise. So then we evaluate that at two different points, X equals to 0 and X equals to W. We get two different set of inequalities. So after we rearrange them, we get these two inequalities, which is equation 4 prime and 5 prime. I have taken it entirely from my paper. So just if you are not getting a flow of the equations, number of that, then don't mind. Just to keep the continuity intact, I have taken it directly from the paper. So what it says is there are two, basically, the one is the upper limit of pi, the penalty rate, and this lower limit of pi, which is penalty rate. So now this one is straightforward because this is independent of the variable of interest, which is alpha. But this one has. Now, before you start using alpha as a shift parameter and see what happens, we have to plot these two sides on a graph. So we plotted them. So this is a function of pi, increasing function of pi, and this is also a function of pi. Now the problem with this is the slope of this line this particular curve depends upon the sign of that depends upon, of course, this particular term which is there above. Because if you impose a restriction on this, this one automatically gets taken care of. So that's where we have come up with two different aspects or two different cases where you're talking about a highly hedonistic individual and a less hedonistic individual. And how we are defining it, we'll directly jump to the proposition basically. So the proposition says that, if we increase the alpha or the altruistic parameter as a shift parameter, then what happens is the lower limit of pi, which is the penalty rate, goes down unconditionally for the highly hedonistic individual and conditionally for the less hedonistic individual. Now, unconditionally, now why it's conditionally for the less hedonistic individual? Because for the less hedonistic individual, this curve, this downward sloping curve, will not be downward sloping; it will be an upward sloping curve. So if it's an upward sloping curve, the problem is, if let's say the slope of this is equal to the line which is going through the origin, which is 45 degree, and then the slope, let's say, it would be equal to 1. If that is the case, then it might so happen that these two lines do not touch each other. So if they don't intersect, then the whole point of doing this analysis will not make much of a sense. So we have to put some restriction on that so that at least it intersect once. And that's possibly the reason why it's conditionally for the less hedonistic individual. Now, what it means is that if the taxpayer becomes more altruistic, the person would need a lesser penalty to start paying a non-zero tax amount. But note that as he moves upwards, the effect fades out and the total disclosure of the amount happens only at the previously or predetermined higher limit or upper limit of pi, because the upper limit of pi is independent of alpha. So that's why, even though it kickstarts the person's willingness to pay the tax amount at an earlier stage, you don't need to have a very harsh penalty to make him do that, but gradually it fades out. So now let's go to the comparative stats, and let's see what is a proposition, what is our next proposition saying. So the comparative stats, of course, we know that we assume that the optimal level of declared income be X star, which is a function of the parameters, and then you differentiate the first order condition with respect to alpha to get the following two subcases. So we get a del X by del alpha, nice equation of that format. And what we try to do, because it's a very complicated, big equation, we try to analyze it by taking limiting cases of P, which is the probability of getting caught. So what we say is, let's say when the probability of getting caught tends to 0, a zero baseline, zero deterrence level scenario. And when the case when the probability of getting caught tends to 1, in this with a pi greater than theta, because equal to theta or less than theta doesn't make much of a sense. So what we get is, in one case, we see that as the altruistic parameter goes up, the evasion goes down. And the other case, we see that even when the altruistic parameter is going up, the evasion is not coming down, rather it is going up, which is a bit counterintuitive. So what we find is, in a proposition format, you have to say is that when the taxpayer is moving from a state of low probability of audit to a state of high probability of audit, or high probability getting caught, the evasion increases with an increase in the value of parameter capturing altruism. Now, this is a theoretical result that we got in a field experiment in Germany conducted by Dwenger, Clevin, Russell, and Rinke. They also found that a significant amount of the citizens in that particular country comply at a zero deterrence baseline, where they don't have basically any audit probability, any penalty of probability of getting caught, and they are actually doing the compliance, making the compliance decisions being driven solely by their intrinsic motivation. And also, to talk about the second part of the proposition, how an external intervention in the form of higher penalty would eventually drive your intrinsic motivation away, is also supported by the recent empirical literature by Bowles, Polonia, Reyes, Frey, 1997, and etc. Now, moving on to the third propositions of a model. To do that, what we thought is, now the variable of our interest, the exogenous variable of the parameter of our interest, should be pi, or the penalty rate. And we wanted to see how the tax evasion decision changes with respect to a change in the penalty rate pi. Now, what we find is basically the response of to high penalty, the response of the individuals under the presence of altruistic preference, or under the presence of altruism, to the increase or decrease of penalty rates does not necessarily have to be a very simplistic kind of a relationship or very linear. Whenever a penalty goes up, the compliance goes up, or whenever it goes down, or something like that. It need not be so. Rather, it is much more ambiguous than what was thought of. So what we see is that if the representative taxpayer is altruistic, then under a certain specific parametric restrictions, which is also basically saying that, if the taxpayer is very altruistic, then after a threshold, after it reaches a positive threshold, it may no longer ensure compliance, how much ever you increase the penalty rate. And if you are below that threshold, if you increase the penalty rate, compliance will be ensured. So you can see that there is no unambiguous answer to this kind of response, whether the person will be compliant with a high penalty rate or not. It may eventually drive out their intrinsic motivation as well. And the recent evidence also corroborate the same. Now, let us move on to the second part of the extension of our model, where we talk about the altruism, the moral costs, and the evasion avoidance trade-off that is existing. So most of the time, most of the papers that I have seen, or we have seen rather, either consider tax evasion as one particular problem, a sole problem, and devote time to that, or they consider tax avoidance as a sole problem and devote time to that. But we believe that if an individual is aware, an individual taxpayer is aware of the tax evasion as well as the tax avoidance opportunities, he may as well exploit them. And what he may do is a kind of a portfolio diversification kind of a problem, where he would see how much I should avoid and how much I should evade. So then it will become a decision that he has to take between how much amount of money he wants to evade and how much he wants to avoid. Now, the problem is avoidance is it does not have a it does not have a legal sanction on it, because it's not illegal. Right? It's just trying to make sure that you get to know the loopholes of the system and try to exploit them. So that's why we thought that let us introduce the moral cost of avoidance and evasion into the model. And these are per unit moral cost, TA and TE. TA is the moral cost of avoidance and TE is the moral cost of evasion. Now note that we have introduced one more variable, one more exogenous variable or parameter over here, which is the S. Now, a proportion S is what of the revealed income the taxpayer would actually reveal to the tax authorities. So 1 minus S will be what is not revealing. And that's how we designed, we just tweak around our the base model and try to incorporate it this way. Now, also note that the tax, the tax rate that is being imposed over here upon the taxpayers is no longer theta, it's theta prime. Just to avoid the clustering of unnecessary terms, we have assumed that the 1 minus 7 to theta prime is basically theta, so that the entire structure remains the same other than the introduction of TA, TE, and S. Now, we move on with the same kind of approach that we have resorted to in the previous segment of the paper, where we evaluate the first order condition at the S equals to 0 and X equals to 1, so the lower point and the upper point, because S equals to 1 is the maximum that S can go. So S equals to 0 means he's avoiding completely, and S equals to 1 means he's not avoiding at all. Now, once we do that, we get two nice equations. And once we get the two nice equations, like the two inequalities that we got, we again do the same analysis. We plot them on a graph and see. And now, and this particular time, what we get is not penalty rate on two sides of the equation or the inequality. We get the moral cost of avoidance on two sides of the inequality. Okay, that's the difference. And we again use alpha, which is the altruistic parameter, as the shift parameter, and see what happens. So what we get to see is both the lower limits and the upper limits of the moral cost of avoidance comes down. So that means an increase in the altruistic parameter would eventually make the taxpayer start refraining himself from the act of avoidance at an early stage. and eventually reach the last stage where the avoidance is zero also early. And that's happening when we're increasing the altruistic parameter alpha. Now, let's move on to the last and final proposition of the model, where we evaluate the first order condition. Now we are trying to find out the integral solution for the x. Previously, it was avoidance. That's why the variable of concern was s. Now the variable of concern is x, because we're trying to find out the integral solution. So for that, we evaluate in the same way at x equals to 0, x equals to w. And again, we find two nice set of inequalities. This time we have pi on both sides. Pi is on the left-hand side of the inequality and also on the right-hand side of the inequality. But this time, because we have already seen the kind of relationship between pi and alpha, we thought that let us use a different parameter as a shift parameter this time. So we thought of using the moral cost of evasion, or TE, as a shift parameter, and see what is the relationship between pi and t. So once we did that, the result that we got is as follows. So basically what we're trying to say is, keeping all the parameters constant and increasing the value of the moral cost of evasion, which is TE, increases the corresponding penalty rate, and vice versa. So what it means is, if the moral cost is high, the moral cost of the individuals or the taxpayers is high, it is a suggestive fact that the concerned authority of the government should also increase the monetary cost, so that in case the monetary cost is low, let's say, what happens is the taxpayer then gets encouraged to take advantage of the arbitrage opportunities that are existing. So whichever cost is lower, he'll try to do that. So in order to make him avoid doing either of these two, it is a suggestive fact that the concerned authority should ensure that if the moral cost is going up, the penalty rate also should go up. If that is going down, then the other one also should go down, to discourage the taxpayer to exploit the arbitrage opportunities existing in the tax system. And those are the 5 main propositions that we have found. Now, at the end, let us summarize the findings and also talk about the limitations and scope for further research. So the propositions we have seen in this model highlight the importance of altruistic preference in decision-making process of a representative taxpayer. It also gives us a counterintuitive result as to higher evasion being coupled with higher levels of altruism. And also we got to see that external intervention need not always make the situation better. It may make the situation worse off by driving away the intrinsic motivation that is there inside the taxpayers. And you also see how the evasion avoidance trade-off also gets influenced by the presence of moral cost. But we still believe that it will be more interesting, because it's a static framework that we have had. It's not a dynamic framework. So we believe that it will be more interesting to consider a dynamic framework and see if the results of this particular static design hold good, or the kind of changes that are being brought about. That will be very interesting. That is one. The other one is the empirical validity of the propositions. Even though it might look nice and sound on the paper, mathematically speaking, but whether empirically they are right, or can be validated in a context of India, where the tax evasion problem is quite huge, or not, remains to be seen. Yeah, that's all my time, and these are the references that I've used. Thank you. Thanks.
Thanks, Ronak. Thanks for presenting a very interesting paper. I see one question from the audience, which I'd like to place. In the interest of time, we'll keep it to only one question. What will be impact of felicitation of people complying with tax to tax evasion? Is there any theoretical consideration?
Not that I am aware of. Not that I am aware of.
Okay. Thank you. On that note, I think we'll begin the discussion of the next paper. The next paper is being presented by Suresh Udwas Chandani from the Central Bank to Monetary Policy Committee. Has the communication effectiveness improved? Yeah, so I think over to you, Suresh.
Okay, thank you. Let me begin by thanking BSIM for giving me this opportunity to present my paper here. This is I am Suresh Chandani. I'm FPM scholar at SPJMR. This work has been done with my guide, Dr. Vidhu Shekhar, who's faculty at SPJMR. This, as the professor pointed out, is from Central Bank to Monetary Policy Committee. Has communication effectiveness improved? So we'll get straight into before we begin, it's good to set the context that, as we well know, that central banks set short-term interest rates by setting the repo rate. But for them to be able to manage the long-term end of the yield curve, they need to be able to manage expectations of the market participants. And that they do by sharing with the market their strategy of how they will maintain or change short-term interest rates in the future. And even market participants keenly watch this, and based on their anticipation, they take positions in the market. A lot of work has been done in this area in developed countries. And one such work is by Reeves and Savitsky, who's shared that managing market participant expectations is an integral part for the success of monetary policy committees. Now, while we get into the study of communication, we need to even appreciate what is the potential of central bank communication. Now, for that, it is good to share Guthries and Wright's paper. He's done work, they've done work on the Reserve Bank of New Zealand. And they have shown that, when central banks back their communication by policy action, and they have set credibility for their communication, the communication per se acts as a policy tool. So the markets, as soon as the central banks communicate that this is their desired direction, the markets align to that. So very honestly, Guthrie and Wright have found that there hasn't been a need to back this up by policy action. Communication, say, has worked as the policy tool. Cohn and Sack also has found this with the FOMC in the US, that central banks communication can serve as an alternative to policy action. We've also seen that central bank communication, its effectiveness when rates were zero bound in the US. And at that time, communication has helped central banks assure markets that they will keep rates near zero. So that has really shown, with this, we can really get some idea of how important central bank communication is. Now, let us see how, if we look at Blinder's work in 2008, he has shown that when there is a stationary economic environment, there is a well-defined policy, because clearly monetary policy committees have a target, they have a mandate, and they share their strategies with the markets, and there is incoming data that is shared. So Blinder and his colleagues have really posited that if that is the case, then the market really can anticipate this and take a decision without getting explicit explanations. But the key really in Blinder's work is, it is a theoretical status in which challenges, macroeconomic challenges are assumed to be a stationary economic environment. But that is not the case. There are always policy shocks that are happening. There are either there is oil prices, or there is a supply shock, or something else. So central banks need to be able to align to these challenges in addition to meeting their objectives. Even Bernanke has concurred with this, that having a complete and explicit policy rule is not practical. So central banks have to constantly play this role of communicating what their assessment of the macroeconomic scenarios are, how they expect the developments to turn out in the future, and what their strategy will be to address them. Now, as we have mentioned earlier, that there has been a lot of work in this in the developed economies, but there is very limited work that has happened in emerging economies. Now, with this background, Monetary Policy Committee as a framework was implemented in India. There was a formal amendment of the RBI Act done in May 2016. And the first committee started in 2000, in October 16. Now, this gave us an opportunity to really study monetary policy implementation. And so we looked at a period after and a period, comparable periods pre and post, and see whether the effectiveness of communication has enhanced with the implementation of the monetary policy. Now, we looked at research. One of the important papers that I'd like to mention is Kretas's paper in 2002. This is a seminal paper. He's spoken about transparency is the key for monetary policy. He has spoken about the that how the monetary policy makers can use signaling theory and reputation building to be able to build transparency. Newinkiewicz in 2012 has substantiated this with empirical findings that when transparency increases, variation in prices is dampened by the reduction in the expectation bias. Picault and Renault has also shown that the monetary policy, the more the monetary policy shares their current and future projections, the more the transparent they will get. Now, transparency is really defined by Winker in 2000, in which he's talking about transparency being the absence of asymmetric information between the central banks and the markets. And he said that it has clarity, openness, honesty, and common understanding. And now, one of the members of the ECB executive board member, Tamar Ising, has also opined that monetary policies need to endeavor to give clear messages to the financial markets and public at large. Now, if we look at work on clarity, Blinder and his colleagues had posited that higher clarity, the market participants have lesser difficulty in comprehending. That leads to lower uncertainty and hence lower volatility. Now, Jansen, who was also a co-author in Blinder's paper, demonstrated this empirically with higher levels of clarity coincide with lower levels of volatility. There is some work that has even happened in India by Mathur and Sengupta that they have looked at length of the documents as a measure of complexity. And they have shown that when the length of the documents increases, this is when most of their work was in the pre-MPC area, in which when the length of the documents increase, that increases the probability of having diverged interpretations and hence higher volatility. Now, there is also another work done by Henry, which is, he's spoken about surprises on when the announcement date happens. That itself has led to, these are some of the works that we've compiled to identify how we will study the effectiveness of communication. Henneman and Frasky have looked at a higher degree of predictability is an important measure for effectiveness of central bank communication. Batra in India has mentioned that the endeavor of monetary policy is to undertake a balanced assessment and set it out before the public so that monetary policy can become transparent and predictable. So, based on some of this work, we've identified clarity and predictability to be, as measures to gauge the comparative effectiveness of central banks in the pre and post periods. Now, how would we measure this? We looked at text mining as one such tool to gauge central bank communication. And we are going to be looking at documents that the Reserve Bank has uploaded on their website. Now, there is work by Kim and Anderson, who has studied the minutes of monetary policy. And they have said that this is a purposive text. This has been communicated by people with backgrounds in economics and finance, and there is expert knowledge there. They have done deliberations with a target in mind, and their causal and dynamic information there. Their votes have been documented in this. And he's also mentioned that minutes preserve all the text in the original form. There is very little, without any researcher level distortions. So while if we were measuring anything, there is some amount of researcher level distortions, whereas in this case, the documents are the pure text as uploaded, and we could go as far back in time and get the minutes in the original form. So text mining is the tool that I've been using for my paper here. Now, this is our research question. The research question is to empirically examine whether the implementation of monetary policy has improved the effectiveness of central bank communication in an emerging economy, which is India. Now, okay, sorry. What is the data that we've looked at? The data that we've looked at is, we've looked at documents that have been uploaded on the website in the pre and post. So what we have done is that this monetary policy commenced in October 16. We have ended the period just before the commencement of the pandemic. So we've ended it, and the last period of March has been excluded, so that any impact that, any actions that RBI has taken in response of the pandemic will not be impact the study. So we've restricted to 3.5 years in the post period. Similarly, taken a 3.5 year period in the pre period. So comparable periods in for 2 periods. And we've looked at all the documents that have been uploaded for these periods. We have got 88 documents in the pre-period and 104 in the post-period. The documents per se are a little different, because earlier there was a central bank governor who was issuing statements, whereas now you have a resolution immediately after the meeting, and after a 14-day period you have formal minutes that come. All transcripts are similar and reports are similar, which was earlier a 6-monthly kind of an affair. So in the pre-period, we got 24 policy announcements and 21 in the post-period. Oops. Okay, so what has been the methodology that we have used? So one of the scores measures that I have used is readability measures. Now, these are time-tested measures, that is flesh and Kinard readability scores. They signify the number of years of education required to understand a document. They have a score measure to do that. Also looked at FOG scores, which measure complexity of financial documents. So these two measures have been used to gauge the readability of the documents. I've also looked at length of documents, just like Mathur and Sengupta, for in number of pages and number of words. Also, based on Henry's work, I've looked at regularity of policy announcements. How was the regularity in the pre-period and in the post-period? I have looked at the difference between two announcement periods, the number of days, and also looked at the standard deviation within that. For the measure of predictability, normally we look at sentiment based on a bag of words to gauge text, in text mining. But this work has been really very apt for monetary policy documents. This is the automated content analysis. This is work done by Apple and Grimaldi. They've done this in the Riksbank, which is the central bank of Sweden. And what they have done is that it is based on the fact that the semantic meaning of a specific word depends on the context it is getting used. Now, to give you an example, if you use the bag of words approach and you look at just the word growth, that will give you a positive impact about that it is a positive word. But if you add an adjective in front of it as lower growth, that changes the context changes it. It's no longer a positive message. So, that's what really is. And the other thing that is important is that central governments are talking about subtle changes. So adjectives become very critical in gauging what message they are. So this is the word method that has been adopted to gauge predictability. Just like Apple and Grimaldi, they had looked at certain nouns, which is inflation, growth, price, wages, oil prices, cyclical positions, and development. So the similar words have been used. The adjectives have been antonyms of each other for dovish and hawkish scenarios. So the similar words as Apple and Grimaldi, which is dovish, which is in decreasing, slower, weaker, and lower. And there's stem words also. And hawkish have been increasing, faster, stronger, and higher. Now, based on this, the actual number of occurrences have been counted, and that has been given us the number of dovish occurrences and the number of hawkish occurrences. And then a net index has been computed by number of hawkish divided by hawkish plus dovish minus dovish, again divided by hawkish by dovish. And we've added one so that there is no possibility of a negative number coming out. Now, how have we gone about doing this? I've taken all the documents and what I've done is for each policy announcement, a separate corpus has been made. So all the documents pertaining to that policy announcement have been compiled and one corpus has been made. So based on the number of announcements, which is 24 and 21, we have that many corpuses built. From those corpuses, I've used Ngram from which is from the package to extract bigrams and trigrams, concatenated those together. From those nouns, we've counted the number of hawkish and dovish occurrences. And based on that, computed a net index for each policy announcement. And so we've got, and what I have done is that I've tried and applied two models to gauge the predictability. So what I've done is that the net index for each period has been regressed with the change with the next period. So which is RT, which is the repo rate in the subsequent period, which is also auto-regressed with the previous rate, and the net index lag, which is the net index of the previous. And another model has just looked at the subsequent rate change with the net index lag. The repo rate, RT is the repo rate, RT minus 1 is the repo rate in the previous period, and delta RT is the rate change at time t. Now, what have been the findings? Now, if we look at readability scores, and we've looked at, if we look at category of document wise, if you've seen that across all the documents, there has been a significant reduction in the Flesch-Kinnard and in the Fox scores. And if you see, the press releases has had the highest drop, which is from 9.8 to 2.9. And in the case of Fox scores, from 16 to 3.1. The lowest has been in Concord transcripts, which also could be because, this is a face-to-face interaction and RBI has not had the opportunity to improve the content there. Even reports have had this. So across, if you see across all documents, the number of years of education that have been required to understand the text has dropped by 1.8 years. And so this has been a consistent across all kinds of documents that one has found. If you look at the length of documents, the number of words also in these documents have have reduced. And there are, if you see in the quarterly reviews and resolutions, the minutes of meeting, of course, were not there earlier. Press releases and con calls. Across, the number of words have reduced. Only reports have seen a jump in. Now, if you look at the reports, RBI has done a lot of explanation based on prices. They've even looked at agri-commodities and how those prices are getting impacted. So, you know, and they have used the reports to be able to communicate a lot of their strategy on what and how they will react. So reports have gone up, otherwise across the length of documents have come down. If we look at regularity of policy announcements, the difference between policy announcements in the pre-period was actually lower at 51.9. In the post, it was 61. But if you look at standard deviation in that number, because in the earlier period, it ranged from 19 to 63 days. And in post, it ranged from 56 to 65. So the standard deviation has significantly dropped from 12.9 to 3.1. So that removes a surprise element when the policy announcement is going to happen, and hence reduced uncertainty. Okay, now for the predictability, the models two models that I mentioned, this is model number 1, which is RT, which is auto-regressed with the RT -1 and the net lag. Now, we've looked at for both the periods, the pre and the post. In both the periods, RT -1, which is the auto-regressive component, has been significant, whereas the net lag has not been significant in the pre-period and has been found to be significant in the post-period. And this is it's a 3-star kind of significance level. And if you do the same thing with the delta RT, which is without the autoregressive, just the change that has been announced, one has seen that in the pre-period, there is actually even the direction of change doesn't match. And it has not been significant in the pre-period and significant in the post-period. And we can see that in the graphs also, that they are aligning better. So what we have seen is that there is predictability has significantly changed with the implementation of the Monetary Policy Committee. And now it has the hawkish and the dovish tones of the monetary policy have a predictive part on which way the subsequent rate is going to be. So we look at the study clearly shows that clarity and predictability of the central bank communication has improved. This also brings to the fore the effort that the central bank has taken to improve their communications, because clearly they have reduced complexity, they've reduced the effort to understand such documents, and they have even reduced the length of their documents. They have communicated significant amount of information which the markets could use to predict their rates. So significant efforts have gone into this. Now study acknowledges okay, we even need to acknowledge that this was a new effort that we did in India. Clearly there was, even in India, we looked at inflation and growth as twin targets, whereas a lot of international community has looked at employment, whereas here we don't even have credible data on employment. And there is even one would have given it some time for a learning curve for the members, but they have been effective from the way to do. So there has been successful implementation. So to the central bank to have implemented this effectively. Also, this study gives the potential of automated content analysis to be used as a comparative tool across periods. There is clearly learnings for and emerging economies. And given that now that the monetary policy has shown to have predictability, the monetary policy itself can, used to give more explicit forward guidances to the markets. I think that's one thing that can help. However, one of the limitations is that we have not, as a number of studies, volatility is one of the measures that has been used, which is something that is future work that can be used to even implement this and see how effective.
We'll have to start winding up here.
Yeah, I'm almost done, sir. This is
a
nice slide. So that's about it. So I'm open to questions and how this can be improved. Also suggestions on where this can be published. So I would really appreciate feedback.
Yeah. Any questions for Suresh? Okay, Suresh, I'm sure people will reach out to you with further discussion and also for the other talking points and publication and all that stuff. I see already my colleague, Professor Joshi Jacob, joining this link, and we are almost ready to kickstart the next session. So therefore, I'll have to take your leave. Thanks for all the panelists and thanks to all the paper presenters for such a wonderful and insightful session. Thanks, everybody, and welcome, Joshi. Over to you.